I must thank the hard-working team at the ground. I must thank all our partners, IFET, UNICEF, for the generous ongoing support that is provided to us as the Ministry of Health leads the WASH cluster. So a big thank you to all. Coming back to this morning, ladies and gentlemen, a very special occasion as we'll be taking charge of WASH, that's the WASH sanitation and hygiene kits. Before I go on to that, I'd just like to brief you, give you an update of our trip to the West yesterday. And this was part of our public health awareness to actually some of those communities that had been affected by the recent TC, Josie and Kenny. And most of these areas we went to revisit because we had visited these areas just after the floods, and with the team, we went down to the West and selected 5 communities, basically in the informal settlements, and we found that these WASH kits and the work that the WASH cluster stakeholders were doing after the recent floods has been noteworthy. In fact, very commendable, and I'd like to commend the team at the ground level that have been visiting these settlements straight after the flood, assisting them with the WASH and hygiene kits, disinfecting their communities and homes, and advising and creating awareness amongst these settlements about how to maintain good hygiene to avoid outbreaks of communicable diseases. This also allowed us to talk to the communities about the rise in NCDs and how it's become a major concern for us. We also spoke to the communities about dengue, how to combat dengue, and also at length about the mass vaccination that is going to be rolled out next week with the meningococcal outbreak. So all in all, I'd just like to say that the community response has been great. And we are very appreciative that the communities have been very receptive and very positive to the work that has been done by the ministry officials in these areas that I have mentioned. But again, the work must continue. And this morning we see further strengthening of the work that we do in terms of promoting good hygiene and hand wash practices and how to combat not only communicable diseases but as well as NCDs. And I'd like to put on record a big thank you to all the communities that have worked with us, with the health teams at the ground level, to ensure that not only were they prepared, but we provided timely response to the needs after the natural disasters that we experienced. So ladies and gentlemen, any event such as the one that we are witnessing today is in line with our ongoing rehabilitation efforts after TC, Josie and Kenny. And one of the key priorities of our government has been to restore access to water and sanitation for those families who have been affected by these natural disasters. And you and I both know that rehabilitation program takes a long time. So this is an ongoing effort to assist those families. And when we come to basic hygiene and when we come to the hygiene kits that are distributed in partnership with our partners, these are life-changing consumable goods. Okay, people are very impressed with the content of that. And because we promote hand wash, I think the content of the wash kits play a very important role to these families. And not only here, we are told that communities across the world who recover from natural disasters find these kits very, very useful. So thank you very much, madam. Again, one of the things that we emphasize to communities when the team goes out or when we go out to them is the fact that personal hygiene is critical in addressing health issues. That's very important. And we keep on harping to the public that health is also their responsibility. We are partners in maintaining good health. And so maintaining personal hygiene, of course, is very critical for many health reasons, and this is including personal, social, health, psychosocial, or simply as a way to ensure well-being of our families. It's very important. We've heard countless stories from humanitarian partners around the world who have encountered people with easily treatable diseases and illnesses but without resources to treat them from occurring in the first place. So having proper hygiene practices assist in the prevention of many, many diseases, and we've seen that case in Fiji after the recent natural disasters. So ladies and gentlemen, these hygiene kits of a first line of defense against the spread of illnesses that are mainly communicable diseases. Again, yesterday we talked about the need to maintain cleanness not only within their homes, not only personal hygiene and cleanness, but around the communities as well. Okay? Why is there need to keep drains clear? Why is the need for communities to dispose rubbish the way it's supposed to be? So there's a lot of issues going around, and our aim is to find solutions to those issues, and that's exactly what we are doing. So the wash kits that that will be handed in today, and those that have been handed out, are the first steps towards ensuring good health, as they provide tangible hope for those who need these much needed tools. So ladies and gentlemen, once again I'd like to express my sincere gratitude and appreciation to the Australian government and UNICEF for their continued collaboration with our environmental health unit in the procurement of the 1,000 wash kits. Again, these kits will greatly assist our affected communities by providing the much needed support in our ministry's effort in combating communicable diseases post natural disasters. I'd also like to point out that this initiative is in line with the Ministry of Health Medical Services Strategic Plan Priority Area 3 that talks about communicable diseases, environment health, and health emergency preparedness, response, and resilience with its objectives. Objective 3.1.1 is improving the coverage and effectiveness of environment health and risk reduction interventions for communicable diseases. And also 3.1.2 talks about enhancing national health emergency and disaster preparedness, management, and resilience. I'm told and I understand that most of the kits will be distributed first to TC Josie and Kenya affected areas in Reki, Barnendi, and Kandavu, and later on will be pre-positioned in all other districts in Fiji. Actually, ladies and gentlemen, it's truly inspiring to see that people in these communities now have such a wide range of support that will empower them to focus on staying healthy during these difficult and trying times. And we strongly believe that basic hygiene items can make a really big difference in helping people restore their livelihoods and of their communities as well. On a similar note, the Ministry of Health and Medical Services, as a lead agency in the Fiji WASH cluster, would also like to commend all our stakeholders who are part of the cluster for the ongoing concerted efforts to address the WASH needs of affected population and promotion of proper hygiene practices. Once again, I'd like to thank DFAT and UNICEF for their continued support and collaboration with our staff. Of course, this surely marks our strengthened partnership in our endeavors to achieve the vision of a healthy population. So ladies and gentlemen, with these words, I once again thank you for being here, and of course a big thank you to our media partners. You are very crucial. You are a very crucial partner in our effort to take these messages down to the communities to ensure that we are able to achieve the vision and mission of the Ministry of Health. So I thank you for that. And with these words, I once again would like to convey my utmost appreciation to Madam you and your team. And like the Chief Health Inspector said, we hope and wish that we will continue with this partnership in trying to bring about the much needed change in the lives and the livelihoods of our Fijian people. So thank you very much. Thank you. God bless. Questions or anything to the Honorable Minister? Yes, and hand wash. Yeah. Thank you. Thank you so much.